My name is Brian Hendrickson, and I'm doing a presentation on the electrocardiogram, ECG or EKG, depending where you live or your preference. So what is an electrocardiogram? First off, let's look at the nomenclature of it. The first part is electro, which means electricity, and the next part is cardio, which is the heart. And after that is gram, which is a marker or record. Putting that all together, we get electrocardiogram, which is a test that measures the heart's electrical activity. As some of you may know, the heart depends on electricity to pump blood and keep a pulse. This electrical activity could be recorded off of the skin of a patient using leads. One thing that may come up in people's mind is the difference between the EKG or ECG. The truth is that they're both widely used. It's just that the EKG was based off of the Dutch spelling of electrocardiogram because the inventor of the EKG was William Einthoven, a Dutch scientist. So for the electrocardiogram, there's three different types. There's the 3-lead, 5-lead, and 12-lead. In fact, there's actually more types than that. Currently, I read about a 2-lead being invented and 6-lead used as well. But for the 3-lead and 5-lead, those are usually used for ICUs, emergency departments, or telemetry to monitor the patient's heart constantly. 12-lead is used for a more accurate measurement of the whole heart. So if you look at the 12-lead, it actually has only 10 electrodes. But the way EKGs work is that they are based off of the planes of electrical activity to measure different planes of the heart. And so the 12-lead measures 12 different planes, but only needs 10 leads. If you notice, the lead placement is quite complex if it's the first time you've seen it, but I'll start with the easy parts. You could do the extremities, and the extremities shouldn't be on the torso anymore. You should at least be at the shoulder and the thighs. They're pretty straightforward: left arm, left leg, right leg. Next is the 6 that go on the chest. So you start off on the V1, which would be on the 4th intercostal spade of the right sternum. Move your way to the left side for V2. Then go a little bit more left on the patient's body and down, which would go between V2 and V4. And you work your way around. The image doesn't show it well, but V5 is starting to go around your side, and then V6 is actually mid-line of your axillary or your armpit.
What's up?
I'm done.
Okay. Create a YouTube account.
Oh!
I know.
Can you come here though for just a second?
Sadly no.
You're currently looking at a 12-lead EKG, which is normal sinus. However, for most of the slides, we won't be looking at it.
Are you able to play the audio back?
It's quite complex.
Yeah.
Play it and see.
So, looking at one wave, it's called the PQRST wave.
Where did it stop?
During the P interval, you have the activation of the atria, which causes atrial contraction. And then during the QRS complex, you have ventricular contraction when it gets activated by electricity. And then during the T wave, you have ventricular repolarization. You're probably wondering where atrial repolarization is, but it actually gets hidden by the strong ventricular depolarization.
Sign in. Where's the create?
This is just a summary of what I said before, but one thing to note is the ST segment. The ST segment should be baseline to what baseline is for the patient beforehand. If you look before the P wave or after the P wave, the ST segment is at the same level. When it deviates from there is when it's a sign of heart disease.
This normal sinus rhythm, which is what a healthy individual would have.
What the fuck? How do you do this?
This is a systole, which is what a completely dead heart would have. As I mentioned before, changing the ST segment could be quite hazardous. So if you look at the second diagram, the ST segment is elevated. This is also known as the tombstone, which is, the medical term would be STEMI, ST elevated myocardial infarction. Then you can also see that there's a non-ST elevated myocardial infarction below that. These are both signs that the heart is not getting oxygen and is dying off. There's multiple diseases that can be determined with ECG. I only really got a chance to go over one of them. ECG is used for monitoring patients constantly, or for patient transport, while the 12 lead is used for a more accurate overall picture. Thank you for your time, and if you would like to learn more, here are some of the references I used for this.